pandemic has had an enormous effect on neighborhood health and on the communities that we serve. Our patients have been disproportionately affected by the pandemic. They've been sickened at higher rates than other people. One of our primary concerns as the pandemic started was keeping our staff safe, and I feel that we've been very successful in doing so. But then we also wanted to make a difference in the lives of our patients. So very quickly we realized that we needed to go beyond just our patient population and really to the communities they live in to work on controlling the virus in our area. We set up testing clinics around the region, many of them walk up, all of them free, so that our patients and community members in general could be tested. And now that the vaccine is a possibility, we're taking the same approach with this wonderful intervention to stop the pandemic. And we have vaccinated over 12,000 people already, many of whom are our patients, but many of whom are not, and are family members of our patients, household members, or referrals from community partners in the communities that we serve. Equity is a founding principle at Neighborhood Health, that all people deserve quality health care, regardless of their background, regardless of their country of origin, regardless of their financial status. And that's our approach to the pandemic as well. We want to make sure that patients without computers, patients that don't speak English, individuals who might not have a car, have access to this life-saving vaccine. And I'm very proud of how we've made this available to underserved and underrepresented communities in our region. And we'll continue as the pandemic goes on to think of how we can improve the lives of our patients, how we can make it less likely that they become sick, and how we can care for them should they become sick.
2020 was an exciting year for our prenatal program as it marks the first full year of Neighborhood Health offering prenatal care, although 2020 also brought some really unique challenges with COVID-19. We worked really hard to develop a hybrid prenatal care model that incorporated telehealth as well as in-person visits. And it was exciting to be able to offer this telehealth option for our patients as a safe option in pregnancy due to COVID, but we also found out there were many unique challenges our patients face. Many of them struggle to keep regular phone service. Many of them didn't have reliable internet access. So these were all things that we had to navigate to really work to continue communication with our patients and find ways for them to do safe home monitoring of their vitals during pregnancy. Even in-person visits were a little bit more challenging. Many patients were afraid to leave their house even for a prenatal care appointment during COVID. A lot of our pregnant women utilized public transportation, such as the bus or Uber, to get to their visits, and at times this was difficult to access or even, kind of a high-risk activity for them to access. And many of our patients struggled economically as well. Many lost jobs because of COVID-19, and this affected their ability to obtain, basic resources such as food, resources for their baby, car seats, cribs, diapers, routine baby supplies were all harder for them to access. And unfortunately, many of our patients actually contracted COVID-19. We had at least 5 women who were hospitalized in the ICU during pregnancy for more acute care needs. And we even had quite a few more who had milder cases of COVID, but even that piece was very stressful for those women navigating the unknowns of COVID-19 in pregnancy, and also just the ability for our patients to do supportive care at home is more challenging. They may not have the ability to stock up with that 2 weeks of food and fluid supply in the event you get sick. They may not have friends or family that can drop food off for them. And many of them actually don't even have kind of basic medical supplies at home, a stash of Tylenol, a thermometer. So it really illuminated this year that the challenges our patients normally face were so heightened during COVID-19. The community's response through Spring to Action was a huge help for us. Spring to Action enabled us to purchase some critical equipment to continue providing quality care during COVID-19, and also allowed us to make some changes in our clinic to keep our patients and staff safe. We purchased an ultrasound probe to help rule out complications in early pregnancy, which was huge for keeping our pregnant women out of the emergency room, which was especially important during COVID-19 to reduce their risk. And we also were able to institute safety measures in the clinic, changes to the physical space that allowed social distancing, as well as extra cleaning. This was really important to not only keep our staff safe, but also make all of our patients feel like this was a safe place to come to and continue to access their care during pregnancy.
My name is Cynthia. I work at the Casey Center, one of the OBGYN nurse practitioners that provides prenatal care. What I'd like for our community and our donors to know moving forward to support us in 2021 is we are the only provider of prenatal care for uninsured women living in the city of Alexandria. We feel as though prenatal care is very critical in ensuring the best outcomes for both mom and baby. It costs a lot for us to provide the comprehensive high quality prenatal program that we offer our patients. And here at Neighborhood Health, we like to create a medical home for our patients that go beyond pregnancy. For many, it's the first opportunity to get dental care and have access to health services. They have access to pediatric care after the birth of the baby, or we can provide a PCP for them after the baby is born. While they're pregnant, we also like to provide family support, such as resources like cribs, car seats, food, and diapers for patients that need them. And a lot of our prenatal patients are very low income, and about 60% of our patients are uninsured. Patients are assigned a sliding fee, and based on that, they pay a certain amount, but the reality is that very few are able to pay, and we never deny any patient our services. With that, we would need your help to continue to provide this vital service for the patients. We feel as though with your help, we have been able to provide support for our patients and want to continue doing so.
One of our primary goals for 2021 is to increase early entry to prenatal care. When we began our program, just 20% of prenatal patients had access to care in their first trimester. We've been working really hard to increase this and have made great progress and increased our early entry to prenatal care to 63%. We're really proud of this, but we want to continue to push forward with our ultimate goal of meeting the Healthy People 2030 measure of 80% of prenatal patients accessing care in their first trimester. In order to do this, we need funding not only to continue providing, but also expanding our care. We hope to continue to raise awareness in the community about our services through patient outreach, as well as community partnerships. Funding for literature to pass out to patients, as well as events, is a really important way that we can do this. I think we often take for granted that not everybody knows how to navigate that process for entry into prenatal care. Uninsured women have so few options for prenatal care here in city of Alexandria, and we want to continue providing this service to those women. Generous donor funding as well as community partnerships really help us ensure that we have a sustainable program, that we can continue doing this during COVID-19 and beyond.